The Tigray People Liberation Front, also known as TPLF, is committing numerous atrocities within the Amhara and Afar region. Their inhumane and gruesome acts have caused devastation throughout this region. In the past year, TPLF soldiers killed innocent civilians, looted towns, stole what they could, and destroyed everything they left behind. They deliberately destroyed thousands of public and private infrastructure to ensure that the innocent people of the Amhara and Afar region will continue to suffer for many years to come. As TPLF-occupied towns are being liberated by the Ethiopian Defense Forces and their regional allies, reporting of overwhelming amount of destruction of essential public infrastructure such as healthcare facilities are surfacing. Let's have a closer look at the ravages that took place at Dessie Regional Hospital. This hospital is located in Dessie, a town in South Wollo zone of the Amhara region. The hospital serves as many as 10 million patients within a year. Residents within the Amhara and Afar region rely on this hospital for preventative, diagnostic, and surgical treatments. According to the medical director of Dessie Regional Hospital, Dr. Amhara Afar, the overall damage of the hospital sustained is estimated to be greater than 80%. This could mean greater than 8 million people will be directly affected by the damage that was caused by TPLF. Out of the 8 million, more than 5 million people are in danger of losing their life due to lack of medicine, diagnostic, and operative services. For instance, the ICU and surgical facility, all ventilator, defibrillation, CT scans, X-ray machine, surgical operative tables, laboratory equipment, surgical instruments, sterilizers, drapes, gowns, gloves are all 100% damaged. This means all elective and urgent surgical operations are currently suspended. Without these items, critically ill patients will most likely die. The plastic surgery department, Neuro Surgery, orthopedic surgery, trauma surgery units are all completely destroyed. This means treatment for war victim and other traumas, including skin graft transplant for severe burns, are suspended. The maternity unit is completely decimated. TPLF destroyed all ultrasounds, Dopplers, and other necessary equipment purposefully to ensure that Amhara and Afar mothers do not give birth safely. Adding insult to the injury, TPLF intentionally cut the power of medical and pharmaceutical supply storage, and as a result, over 2.6 billion birr or $53 million worth of temperature-sensitive medicine and vaccine are completely destroyed. TPLF stole thousands of medication that are worth billions of birr. They brought their own doctors and engineers to identify medication and equipment to be taken to Tigray. After they were done robbing what they wanted, the soldiers broke the leftover equipment, spilled medication on the floor. They even passed feces and urine on the remaining medication to ensure that no one will be able to identify or utilize these drugs. As if these damages were not enough, over half of the outpatient and urgent care facilities are utterly demolished. Medical professionals are forced every day to turn away thousands of patients because they are unable to properly diagnose and even treat simple or complex illnesses. These are the shocking and devastating facts that took place in one of the regional hospitals within Amhara region. But remember, in total, TPLF looted over 40 hospitals, 453 health centers, and 1,700 health posts in Amhara region. They also looted over 60 healthcare facilities within the Afar region. This only based on paramilitary reporting, and numbers are expected to rise as further investigation follows. If more than 5 million people are in danger of losing their life because of the damage that took place in Dessie Regional Hospital, imagine how many millions of innocent lives within Amhara and Afar regions are in danger of dying and suffering because of the ruthless act of TPLF. According to the medical director, Dr. Amhara Afar, Dessie Regional Hospital is doing its best to meet enormous healthcare demands of the community. However, to restore the services, the hospital needs immediate financial support to purchase critical medical supplies. The following GoFundMe account has been created to collect financial donation for the hospital, which will later be directly transferred to the hospital's bank account. Dr. Haimanut and her colleagues will utilize the money to purchase damaged and looted items. Please click on the link below and donate what you can.